Hey, this is Doc Eric. Welcome to my YouTube neighborhood, the channel where we give you one mindset tip and one body set tip rolled into one video. Today we're going to be talking about all things patellofemoral or knee pain. So let's go ahead and jump in. Patellofemoral pain or knee pain is one of the most common pathologies that are seen by orthopedics as well as those in the sports medicine field. A lot of different research online points to the fact that usually 1 in 4 individuals within a population will experience knee pain in at least some point in their life. I know I have multiple times. So the interesting thing is while knee pain seems to be quite common in the patient population, the treatment options vary wildly. And the reason why is there's various different ways that you can experience knee pain that's going to determine the type of treatment protocol that you're going to be receiving. So there have been numerous studies that have observed and have conducted knee pain and knee pain studies. So usually when they do an imaging study, they're looking for something structural going on, whether it's an X-ray, whether it's an MRI. Some of the things that they're looking at is swelling in the fat pad area, which is some of the buffer tissues around the knee. They're looking for swelling of the joint. They're looking for buildup of synovial fluid. They're looking for calcification on various surfaces. They're looking for tearing in the meniscus. They're looking for ACL and PCL and MCL and LCL ligaments that are being torn that are surrounding the knee, the actual joint itself. Looking for degeneration on the articular surfaces, which are precursors to arthritic conditions. They may also be looking for asymmetrical spurring of the joint, meaning the joint is being loaded on one side versus the other. And of course, they're looking for fractures as well. So the nice part is when you have an imaging study that's done based upon a patient who's presenting with knee pain, and they evaluate for all of the things that I just mentioned, and none of them are cropping up on the imaging study, that typically means that it's not coming from the joint itself or any of the articular surfaces or any of the connective tissues, but in actuality it may be coming from the muscle tissues above and below the joint. And that's a very encouraging thing. You should be very excited about that. And the reason why you want to be excited is because if there's nothing structurally wrong with the joint, that means you can train the muscle tissues that are surrounding the joint, which keeps the joint healthy and supported, to function better, to hold stronger, so that the knee pain starts to become minimized and eventually goes away completely. So the mindset tip and the body set tip today is if you're currently somebody who's experiencing knee pain and you've gone and had an imaging study done, whether that's an X-ray or an MRI, and it's come back negative in terms of a structural presentation, go ahead and find yourself a therapist in your area who's able to treat and work with knee pain as well as give you some corrective exercises. The beautiful thing about that is they'll be able to take you through different phases of care to first get you out of pain and then start to teach you how to strengthen the joint and take it through a pain-free range of motion. And that's it. That's all today's topic on patellofemoral pain and how to get beyond it. So if you like videos like this, don't forget to rate, review, and subscribe. We always like to get new visitors to our YouTube channel. It helps me grow the channel. And also, I get a lot of questions and comments from you guys that helps me grow the channel. So thank you very much, as always, for that. And until next time, stay healthy.